Hi everyone. It's my son being. Hi everyone. Just an update as to my cancer treatment following my lumpectomy, which was on the 25th of January. So now we're on the 12th of February. Today is the 12th of February, but I had a follow-up appointment on the 7th of February, and they confirmed what I thought. I did have, I should say, a grade 3 tumour in my right breast, which has been removed. But because it's grade 3, it is aggressive, and therefore they have suggested that I will have to go through the treatment of chemotherapy and radiotherapy and have hormone medication. I did suspect it, and I was trying to get my mind round to the fact that that was going to happen, but I think it's completely different when somebody confirms it. Um, and I think it was shocking for me to realise that it was grade 3, um, because the tumour had grown from literally nothing to 25 millimetres, which is quite large. And it had grown, and I don't know whether I've said this in my previous videos, but I had a mammogram back in February of 17, and by December 17 that tumour had appeared in my right breast. So within 10 months I had, and I know my operation was on the 25th of January, so probably within about 11 months, just under a year, I had a tumour of that size. And that the enormity of it all hit me at that time. I mean, it really shocked me actually, and it scared me because I thought the story could have been something completely different if I hadn't or felt the tumour. So in a way, because it had grown, it saved me because I felt it straight away, and therefore, I was able to get it removed immediately as well. But really scary, actually, really, really scary. So the plan now is for me to be referred to an oncologist, and I've been told that I need to, one, get a test to see how good my heart is, whether or not I can obviously undertake the chemotherapy, and then two, I need to get a dentist appointment to check my mouth and my teeth for some reason before chemo. To be honest, when I went when I after I heard the fact that the tumour was 25 millimetres, I was in a little bit of a daze and I wasn't listening as clearly as I probably should have been. But I was told that I do need to get a dentist appointment, which I will do. And then I will be referred to the oncologist. The initial meeting is just a meeting to get to know them and them to get to know me. And then the second meeting will be for us to consider dates for chemotherapy. And I'm expecting it to be early March or towards mid-March. Really weird. I'm not that scared about chemotherapy. I know that it's something that I will have to manage, but obviously I don't know what it is as yet and how it's going to affect me, and so therefore how do I manage it? So the first two sessions are going to be a learning curve for me and for me to know how it affects me as well, which is going to be really important. But the cancer nurse was fantastic in that she said to me and advised me, which I'm sure they do with most cancer patients where there is treatment available, for it not to stop your life. I have a dog, and so I take my dog out walking every day. And for me, that's a really important thing to do, and I feel fantastic doing it. So she told me not to stop doing it. If I'm able to go walking, but just be aware and careful of infection during chemo because my immune system won't be there and as able to fight any infection. And the other thing she said is if you're able to work. I mean, I'm self-employed, so I'm flexible and I can manage my time. But what she was trying to say is just don't allow this cancer or this treatment to overtake your entire life. And I think she's absolutely accurate in that. and that's what I need to do, because I think otherwise if you're an active person and you're a busy person and you like doing things outside or you work, then you should continue to do them things as much as you possibly can, because it's not just the physical part of this journey, but it's also the mental element. And I think sometimes the mental element is so important. It could change your outlook on a day-to-day basis. So she did say to me, there's going to be days when I'm not going to want to get out of bed, and there's going to be days when I'm not going to be able to get out of bed. But the days that I don't want to get out of bed, but I am able, I should do. And I'm going to try and keep that advice at the forefront of my mind. The other thing she did say, which is, as time goes on, necessary for me to deal with, is my hair. Now, as you can see, this hair is short now. It was all the way down my back, and I had it cut before my lumpectomy just because it was easier for me to handle it and deal with it. My hair is a huge comfort to me. It's always been long. I love it. I absolutely adore my hair. But I think I have to accept that I'm going to lose it. So I need to prepare for it. So I have spoken to my hairdresser about it, and she has said that, and she's very pragmatic, because she's had other patients who have been in the same situation, need to go through chemotherapy, and she's just said, if you need to cut it, cut it. We will do it. It won't be an issue. Just do what you need to do. It will grow back. So I have an appointment on the 22nd of this month, and then I think I'm going to have to let it go, basically, and just maybe play with it. You know, for the first time, I haven't been able to just, I don't know, explore different hairstyles. So in cutting it, being forced to cut it, I will be able to do that and hopefully have some fun with it. And then I'm going to get myself down to a wig supplier, and there's one local to us, so I'm going to go and see her, and I'm going to explore and check out some wigs. Wigs are just a normal part of a lot of people's lives, whether you have cancer or you don't have cancer. It's just something that people like to wear. So that's what I'm going to do. I'm probably going to buy a couple of wigs as well, so when I do start losing it, then I can wear my wig in the meantime. But that's where we're at the moment. Emotionally, it has been difficult. Physically, getting back to normal. This is my second week. I'm nearly there, but evenings I do get tired. There's other days when I don't want to go out, and I don't, because I don't want to go out. So I just listen to my body, and I'm just being kind to myself. I'm still working, but as I say, I'm self-employed, so I don't have to run to anywhere. But I try and keep my sanity by doing my work, which I love. And it has been a period of pure, it's very strange, but a period of pure clarity, actually, because I prioritised my life in a completely different way. And I realise how precious time is with my loved ones, my family. And I've rediscovered relationships that I had lost. So I invest more time in my relationships as well now, which is hugely important to me. I am enjoying my time, actually, more so than I ever did before I had this diagnosis, in terms of spending time with my loved ones, my family and friends. I've reorganised my work, and I've reorganised our finances as well. So I'm not under stress throughout this year. I'm worried about funds coming in to pay bills, etc. So this has been a period of pure clarity and just calm. And that's how I want to continue it, really, for chemo and radiotherapy. So in a way, it's an awful thing to hear that you've been diagnosed with cancer, but I'm trying to use it as effectively as I possibly can, so it becomes a positive change in my life. And I think I have to give it that respect, to say that it has the ability to do that in anybody's life. And so I'm gonna try and grab it with both hands and make it a way to deal with it in a positive way. So love to you all. I hope you're all very well, and I will speak to you when I probably have my first chemo sessions. Fingers crossed, all will be fine, but I will try and keep as sane as possible during that time. Thanks for watching. Bye bye now.